Hi everyone, how are you? It is Dr. Emily, functional podiatrist and human movement specialist. So I want to take you through an awesome peripheral vision training exercise that I learned from my vision therapist, but I am of course adding a little bit of a Dr. Emily spin to it, which is going to integrate all of our sensory input systems from proprioceptive, mechanoceptive, visual, and vestibular, and then bringing that into how you actually control your body in space through the integration of all these symptoms. Now, for anything that you're doing, whether it's visual training, vestibular, or just sensory-based training, you want to make sure that you are taking off your shoes, you are barefoot. I'm actually on Naboso flooring. If you do not have Naboso flooring, then I would say maybe put on some Naboso socks, put some mats across some of the Naboso mats, or if you are on a hardwood floor, then of course that will work as well. In my hands, I have the sensory sticks. So these have texture. The texture is going to stimulate the nerves, the mechanoceptors in my hands, but they're also weighted. So they're 2 pounds weighted, which means they are going to tie in the proprioceptive system. So I've got 2 of those systems going, and then we're going to be moving. So we're going to be using the vestibular system when we're moving. And then for the visual system, I'm going to be cueing some peripheral vision awareness. Now, this is going to be based off of movement and our ability to tell when we are moving in one direction and then the other direction. So I'll show you a little bit on how that's going to start. So the first part, I want you to actually understand that where we feel our body in space, which is called body schema, is this complex process of the nervous system. And we should be able to feel or sense our body in space through really that kind of intuitive awareness or connection. There's not really words to describe it. Now, how you can start to connect with that is I'm going to have you stand behind or in front of a wall. So if I'm standing by the wall, I'm not against it. I want you to start against it, and then you're going to step just a couple inches in front of it. So you're very close to the wall. You can connect to the wall. If you lose your balance, you could fall back against it. And then I'm standing with my feet shoulder width apart. I've got my sensory sticks in my hands. My eyes are shut. And then I'm going to just feel and sense my body in space. Now, if you're doing this with me, or if you do this after you watch the video, what you should feel is I can actually feel the presence of the wall behind me. So I know that there's something behind me based off of my proprioceptive and mechanoceptive system, feeling that wall behind me. That mind's eye is sensing and feeling the wall. So I want to take that in and I want to acknowledge that, because we're going to be using that for the next part of this exercise, which is actually moving and knowing when to stop. So I'm going to be walking forward and I want to stop. I'm actually at the edge of my table right here. And I want to be able to know exactly where to stop without looking down at the line or looking at the table. My eyes are straight ahead. Then we're going to be walking backwards. Of course, I'm not going to be looking at you when I actually do this. You're going to be walking backwards, and you're either going to walk in a space where there's a wall behind you and you are going to stop before you hit the wall, or for the sake of this video and the distance that I'm walking, I put a chair behind me, okay? Now we have to calibrate both. So I'm starting on my end point, which is the chair behind me. My hands are by my side, my knees are soft, I'm barefoot on my Naboso flooring, and I'm going to do what I just did against the wall, is I'm going to shut my eyes and just sense and feel and connect with the awareness or the perception that there is a chair behind me. I can actually feel that something is behind me, okay? Then what I want you to do is you're going to open your eyes and you're going to look far ahead. So I'm looking in the distance, soft gaze, almost as if I'm looking through the wall in front of me. And while I do that, I have to move my hair back, otherwise it blocks my peripheral vision. So what I'm going to start doing is taking in the room peripherally. So I'm staring straight ahead, one spot, far, far, far into the distance. And then I'm starting to notice things. So I notice in my peripheral vision, I have my computer over here. I see my water. It's the edge of my table. There's a white chalkboard over here. And then on this side, I can see the edge of this picture. So I can see the man running and then kind of where it's changing from this grayish to the white. So I'm taking in everything peripherally as I'm staring straight ahead, soft gaze as far into the distance that I can. Now, for the formal exercise, as we stand here and you're going to keep looking ahead, you're going to start to walk. So as I'm looking ahead, I see the table in my peripheral. I see the camera as well, and I know exactly when to stop so that I'm directly in front of the table. I don't run into it and I don't hit it. Now I'm going to start walk backwards. And as I'm walking backwards, I'm trying to swing my arms. And as I'm walking backward, I'm taking in all this peripheral information, but my eyes look straight ahead so that I can stop exactly where I'm going to stop. I'm in front of the chair, but I don't hit the chair. Make sense? Okay, so I'm going to do another repetition of that, not talking, so that I can focus on my peripheral. And then I stop directly at the table. And then I'm going to walk back. I'm looking straight ahead. And am I there? Yes! And then I'm walking forward. So I like to do this, and I have my patients do this as part of their peripheral training, their peripheral vision training, as part of their movement optimization program. You could do 8-10 repetitions of that, trying to stay nice and relaxed. You're focusing on that soft gaze, taking in all of that peripheral information, but you're really utilizing the proprioceptive and the mechanoceptive tools to get that complete stacking or integration of sensory information. That is going to be much more powerful than if the individual has nothing in the hands, shoes are on, and they're thinking of it just as this visually isolated exercise. So try to stack as much as you can. I, of course, would flow this into a bunch of other exercises that I incorporate for my patients, but this is a really good one that is awesome for peripheral, vestibular movement. You're holding something weighted. If you don't have sensory sticks, hold 2-pound weights or something around that 1 to 2 pound weight, barefoot, naboso stimulation, and then connect to that body schema and that perception of self. It's a really great exercise to be next to something, and can I feel just the presence of the wall or the chair or the object next to me and how I perceive that through this integrated system. I hope you enjoyed. If you want to learn more, then do check out my website, dremilysplickle.com. I focus on chronic conditions and movement disorders. Stay awesome. Happy holidays, and I will see you soon.